News Now Special Edition.
Good afternoon, and thanks for joining us here at 4:30. I'm Vanessa Murphy. This is a special edition of 8 News Now we're calling VAX Facts for Kids. Now that children as young as 5 can get the COVID-19 vaccine, we want to help families sort through information. Right now, just the Pfizer vaccine has received FDA approval for kids ages 5 and up. Now joining us in the studio to answer questions, Dr. Rutu Ezutechin, also known as Dr. E, board-certified pediatrician, and Joanne Rupert, Chief Administrative Nurse at the Southern Nevada Health District. We also have a group of parents joining us on Zoom here because this is a mix of vaccinated and unvaccinated individuals here. The hope is for this to be a judgment-free zone and to have a productive discussion. Now let's start with Dr. E. Can you tell me what you believe are the benefits and risks of the COVID-19 vaccine for children?
Yes, absolutely. So I think when we're talking about the benefits and the risks of the vaccine, we just need to understand that the landscape for COVID-19 has changed significantly in just a year and a half. When we first started having our lockdown in March 2020, that variant, that original COVID strain was not making children sick the same way. They were seeming to be relatively untouched, not getting hospitalized, not dying from it. However, this past summer, when the Delta variant started, we started seeing children get sick, and pediatricians really started listening and noticing. We saw a 5-fold increase in hospitalizations. We've started having children dying from COVID. We're seeing increases in multi-system inflammatory syndrome, which can last for months for some of these children in terms of side effects. So this vaccine now is effective against the Delta variant, and the benefit is it can prevent hospitalization, it can prevent death, it can prevent the multi-system inflammatory syndrome that children are experiencing. The risks are the same as any vaccine: redness, soreness in the arm, fever, chills, and that's really your body saying, hey, I'm making an immune response and this vaccine is working. The risk of something really serious like anaphylactic shock is the same with the COVID vaccine as it is with all the other vaccines that your children are taking.
Thank you so much. Now let's go to Brian Almero. Brian, you are a dad. You told me you and your wife are vaccinated, but you're on the fence about getting the vaccine for your child. Can you tell me why?
So, I mean, it really comes down to it is the side effects. Yeah, I mean, my wife has been vaccinated since, beginning of the year or middle of the year. And it's the main concern really is, I know she mentions the usual soreness and the usual, the way adults have it is going to be the same as on the children. It comes down to it is really what more? Is that really all the side effects, or is it more to it? I mean, has it been really tested? I mean, that's really my concern. So it's kind of like we're in the fence. If we're going to do it right away, or is it better to wait?
Thank you so much. And Dr. E, are you seeing this, parents like Brian who are on the fence, and what would you say to them?
Yeah, definitely. I mean, it's very understandable to want to know as much as possible before administering this for your child. And I think what I would say is, in terms of the testing, this vaccine has had over 400 million doses in the country. And so it's one of the most studied vaccines we've ever had out there. So that the studies are robust. Lots of people have been getting it. They're tracking the safety of it, and it's showing to be more effective in younger kids, and they actually have less side effects than older kids and adults.
And for Joanne Rupert, can you talk about, are you seeing this at the health district, some parents like Brian being hesitant, and what would you say to them?
Well, certainly I can understand their concerns about vaccinating their children. This vaccine, has been rolled out. It started last July in 2020, but the research for the mRNA, the messenger RNA, has been going on since 1990, and now that we're in this pandemic, the urgency really forced the rapid development of the vaccine, and we were able to also receive the researchers were able to receive funding for it. So the government had put a lot of funding into getting this vaccine developed and then also tested.
Thank you so much. Now, up next, we'll hear from more parents, both for and against the COVID-19 vaccine for children. We'll be right back. Welcome back to our VAX Facts for Kids town hall. Let's go to mom of two, Skyler Goodman, who says she is not vaccinated and doesn't plan on getting her children the COVID-19 vaccine. Skyler, I know you have some time here. Your oldest is 4 years old. You told me your concern was that you feel that the approval process was fast-tracked. Can you talk about that, and what's your question?
Yeah, so I definitely feel like there hasn't been enough time to conduct long-term studies, whether or not there's been enough money put into conducting these studies. There hasn't been long-term studies actually put forward. So for my question, I would like to ask, according to the American Academy of Pediatrics, the mortality rate among children is 0 to 0.03%. So why should I, as a parent, risk my child obtaining any side effect or adverse reaction to the vaccine, like the many cases already seen among adults?
Dr. E, can you address Skyler's concern here?
Yeah, absolutely. So I think one thing to point out is when you're looking at mortality rate, they're looking at the collective mortality rate pre-Delta variant as well, which we know was milder, which we know had a much lower mortality rate. So as this continues, this pandemic, those numbers may shift. The other thing is, you know, how many deaths are okay, and do we want to risk our own children as part of that? And you know, here in Clark County, we have had some deaths already, and we've had over 90 cases where children have had significant serious consequences with long-term inflammatory organ damage from it. And so in my opinion, it's kind of like a seatbelt. It's not 100% guarantee, but I want that layer of protection for my kid and for yours as well.
Skyler, hearing that information and those numbers, does that concern you, and do you feel like you're willing to take the risk Dr. E is referring to?
Yeah, I mean, considering the mortality rate among adults, I mean, the survival rate is as well 97 to 99%. So to me, the risk of my child obtaining even a side effect, but more so importantly, a long-term condition or an adverse reaction, to me, isn't worth them taking the vaccine when it's shown that it's not as effective as it could be when there's people still getting positive COVID results fully vaccinated.
Joanne Rupert, the health district would be aware of something like complications from the vaccine, right? Or what kind of information does the health district collect about concerns Skyler's referring to?
Right. Well, if there is any adverse event after the vaccine, we would get that information, and then all providers can also report it to the government. We do know that that most of the deaths and hospitalizations that occur are related to unvaccinated people. For vaccinated people, it's a small percentage.
Thank you so much. Now, when we come back, we'll hear from a parent who says he's not an anti-vaxxer, but he is against the COVID vaccine. He'll tell us why. You're watching a special edition of 8 News Now at 4. Welcome back. Let's go to mom of two, Jacqueline Cooper, who says she is for the vaccine. Jacqueline, you told me one of your concerns is that you feel like there is resistance to the vaccine in the community, meaning people who are refusing to get themselves, their families, and their children vaccinated. What's your main concern?
My main concern is we look at people in our society and in our community, and we're judging them whether or not they're being safe. And that blows my mind that we're taking something as simple as humanity and making it such a huge variant in our culture. I mean, you look at me, you wouldn't know that I have a sister who has a child at home with childhood cancer, and she can't leave the house because of COVID and what's going on, and she can't have him get vaccinated because of his immune system. And I have to protect myself and my surroundings because I do come in contact with her. And so I'm shamed by other moms and I'm laughed at for wearing masks in public, but you wouldn't know that unless you knew my situation. And it's frustrating and it's discouraging and it's disheartening that people are so selfish during this time. And we have the ability to build up this great herd immunity and to make these great strides to protect those that are less likely to overcome this disease. And we're selfishly just ignoring science blatantly. And I just can't get my mind around it. At what point did we stop trusting the professionals? And at what point did we stop having compassion for each other and empathy? And that's what's really on my mind lately.
And thank you, Jacqueline. Joanne Rupert, is this something you see about parents really being polarized?
Well, I can understand Jacqueline's point of view as far as having someone in their family with cancer and a compromised immune system, and that is a lot of concern with those people who cannot get the vaccine or it doesn't work as well because of their immune system. So you do have to do a kind of cocooning around that person to make sure that they don't get sick. And children, sometimes they also feel anxious being out in the world. They're afraid that they might get sick from COVID. So maybe having the vaccine would actually make them feel better and more confident about getting out and going to activities, going to a friend's house.
Thank you. And Jacqueline, tell me the ages of your children.
I have a 3-year-old and a 9-year-old.
And what is the status of the 9-year-old as far as the COVID-19 vaccine?
We just got home on a delayed trip last night. Sorry for missing yesterday. So we have not had an opportunity to vaccinate her yet, but we have an appointment scheduled for this week, and she will have her first dose.
Okay, thank you so much for sharing that with us. We are going to now switch over to father of 6, Brian Dawkins. He tells me he's not an anti-vaxxer, but he's against the COVID-19 vaccine for himself and his children. Brian, what is your main concern? What's your question?
Well, let me preface my comment first by saying that I have nothing but respect for people's decisions regarding masking, social distancing, and whether or not they get the shot. I just believe that it needs to be a personal decision, not one that's coerced. And I do have several areas of concern, but what's most alarming to me is the fact that Congress preemptively indemnified the pharmaceutical manufacturers against civil liability if something goes wrong with the shot. They've actually been doing this since 1988, and another law was passed in 2005 to further protect the drug makers. And what that does is it doesn't protect the patients. So if I or my wife or my children decide to get the shot and then have a adverse reaction, myocarditis, or down the road we find out that they're all infertile because of something that happened because of the drug, we have no legal recourse. We cannot sue the drug makers.
And I'm going to turn to Joanne Rupert of the Southern Nevada Health District to address that. Joanne, what would you say about Brian's concern?
Right. So for the, I'm the local health department and a healthcare professional, so I really can't say anything about the legal aspect of it. But there are a lot of good information on the CDC website that talks about that and how did that come about and how that process is for those who may experience adverse events.
Thank you so much. And back to Brian here. Brian, could you do me a favor and tell me the ages of your children? Also, a couple of follow-ups here. Have any of them contracted the COVID-19 vaccine, and do any of them want the vaccine?
I'll try to remember your questions in order. My children are 17, 15, 15, one's turning 13 tomorrow, a 12-year-old and a 9-year-old. And no one in my household has had the virus, and no one in my household has any interest in getting the shot, and would rather not wear the masks or following the protocols, although, again, we're respectful of other people's decisions. When we're asked to do those things, we comply. but it's not something that anyone in my household is interested in pursuing.
Brian, are your kids attending school, or what's the situation?
My wife and I educate our children at home, but our children are active in the community. They're involved in several social organizations, and they have continued to be around their peers and adults for the last year and a half without any adverse reactions.
Has any information that you've heard here so far in this town hall swayed you one way or the other? Do you see yourself ever changing your mind?
I'm open-minded. I'm willing to change my mind if facts present that would encourage me toward that conclusion. But no, nothing that's been said here is any different than what we've been hearing the last year and a half, that we should trust the experts and just go with it. And I realize that adverse side effects from vaccines are rare, but as Skyler pointed out earlier, so is death from COVID. So we're weighing one slight risk against another slight risk, and when we choose to get the shot, as I previously stated, there's no legal recourse. While there are injury compensation programs administered by the government, they have very low financial caps that don't measure up to what a lawsuit would result in if something was done incorrectly. So no, nothing's been presented that could change my mind so far.
Okay, thank you, Brian. I want to go back to Dr. E. Could you weigh in on sort of Brian's view here?
Well, again, I'm on the medical side, so in terms of compensation and sort of the recourse piece, I'm no expert in that. But in terms of, science and the experts, I understand that this is a global pandemic and things are continuing to unfold before us, and I love hearing that he's open-minded, because as evidence comes forth and things change and maybe the landscape changes, he might hear something that speaks to him, and I believe he would do what he feels is the best interest of his children, which is ultimately what every parent wants to do.
Thank you so much. Now, coming up, we'll see if any parents on our panel change their minds after this discussion. We are live, local, now. Welcome back to our VAX Facts for Kids Town Hall. I want to turn back to our parents here on Zoom. Again, this is a mix of vaccinated and unvaccinated individuals here to listen to our healthcare professionals about the COVID-19 vaccine. You've been listening in. Has any of the information changed your mind? If it has changed your mind, could you raise your hand? Okay. Now, I do want to talk to Brian Almero. Brian, I think you're representative of many parents. You told me you're on the fence. Could you sort of tell me what you thought of the information you heard here today?
Well, the information given by the two professionals was very helpful. But as it stands, I think I will still be in the fence, because this vaccine for children under 12 is really so new, to where it's kind of like the same thing for me and my wife when we waited to get our vaccine. It's just really finding out more information about it, getting experiences from other parents, because it's really a risk. I mean, anything is a risk, but for our children, I mean, it's much more important that we make sure that they're safe. So, I mean, my stance is still going to be in the fence and really wait a few months maybe. It depends on how much more information I could gather and, facts involved in it. So.
Okay, thank you so much, Brian. Dr. E, what could you say to wrap this up?
I would share that, again, over 400 million doses have been given in the United States and over 7 billion worldwide. Highly studied, very safe, very effective against COVID, and luckily against the Delta variant as well. So, we have something in our arsenal to protect our community. And, I'm encouraging people to really consider it and talk to their doctor if they have specific concerns. Never forget to do that.
And Joanne Rupert of the Southern Nevada Health District, I know you said there's many resources for parents to do their own research.
There definitely is. I would really encourage people to do their research. Use credible resource. The CDC has good websites. Children's Hospital of Philadelphia, healthychildren.org, all really good resources with videos, and really can give you a really good visual.
Thank you so much. Again, thank you to our parents for joining us. We appreciate you sharing your viewpoints. Thank you to our healthcare professionals in the studio. We hope you had some of your questions answered during this time as well. We have to wrap it up. Thank you so much again for participating in our VAX Facts for Kids Town Hall.